Welcome everyone. Thank you so much for joining us today for our weekly Tiger Talks. My name is Lindsay Bray and I'm the Senior Coordinator for Parent and Family Services here at the University of Memphis. So today we have the Assistant Dean, Dr. Eric Bailey, with us from the Loewenberg School of Nursing to talk with you about what it means to be a nursing student and the services that they have available for our students to help them succeed. So thank you so much, Dr. Bailey, for joining us.
No problem. Thank you for having me. And I would be remiss if I didn't say Loewenberg College of Nursing. My dean would not appreciate it, but Loewenberg LCON, Loewenberg College of Nursing. Happy to be here. Happy to talk with you guys about what our college offers, our different programs, particularly our BSN programs, which is our most sought after program.
Eric, can you tell us a little bit about yourself and your role at the college?
Yeah, sure. So in my role as assistant dean for nursing students, let me preface this first by saying I'm not a nurse. So in my role, I serve our students. I'm over our admissions process, all of our recruitment, our academic advising, our tutoring services, our scholarships, our progressions, our diversity and inclusion efforts. So a gamut of things related to the support of students and creation of a sense of belonging while they're there in the program. It kind of works well with me being a non-nurse in leadership position over there because it breaks up the dynamic. We have all of our nurses, our dean who is a nurse, our associate dean, our directors, all of them are nurses. And to bring a different perspective, one who's not a nurse. Now, I've picked up a lot of things since I've been in the college. I don't think I've picked up enough that they will give me an honorary degree or anything like that, but I picked up enough in the college to really know about, the structure of the program and how students are progressing through the program, some of the trials and tribulations that they do have while they're in the program. And my team, who is also non-nurses, we are there to support the students along the way.
And you have a lot of experience at the University of Memphis outside of the college as well. I know in student affairs, so you are very experienced for our students in those areas.
Yeah, so I've been with the University of Memphis since 2012. Since I've been with the university, and like Lindsay mentioned, I've been in student affairs prior to me going over to the College of Nursing, and that was in career services, Office of Multicultural Affairs. Also had some part-time stint in athletics prior to going to career services. So the student affairs background is what really helped me transition into acquire this position, simply because it was all of the positions that I've ever had, even prior to coming to the University of Memphis. It kind of wrapped into one. So that was one of the main things that I kind of harped on coming into this role. When I got recommended for the position, I said, what can I do in nursing? I have no idea about nursing. But once it was presented to me as far as what they were looking for, someone who had the programming experience, someone who had the student experience, and it's just something about having a student affairs background. It can be transferable into the academic affairs division as well.
So I know for many of our parents who join us for these, their students maybe it's their first or second year. So can you tell us a little bit about what the process is for maybe a freshman who's interested in joining the College of Nursing to apply and what they need to do to prepare for that?
Yeah, so nursing is the only major at the University of Memphis that you cannot declare as your major. All right. So the thing about that is that if you have aspirations, or if your child has aspirations to go into nursing, they first have to be at the University of Memphis. They are admitted into the University of Memphis. They'll take their general education courses, and then they'll take all of their prerequisite courses to be eligible to apply to the nursing program. So really what I tell parents and students is that everyone's path into the nursing program is different. There's no direct path. There's no streamlined path, so to speak. Everyone's path is different. So some students might come in with some general education courses already complete because they did dual enrollment while they were in high school, which means that they don't have to take as many general education courses or spend so many semesters taking general education courses. They may be ready to apply and eligible to apply to the nursing program after their second semester, whereas others might end up being eligible to apply after their third or fourth semester. Also, some students might choose to take summer school to get some of their general education courses and or prerequisites knocked out. So everyone's path is different. So what we really encourage prospective students to do is work closely with their academic advisors. And they won't be assigned to nursing academic advisors, but we have pre-nursing advisors in the Academic Counseling Center. So those academic counselors, they work closely with the students to prepare them to be a good eligible candidate when they do apply to the nursing program.
So can you tell us a little bit so parents are aware kind of what are those requirements and when should a student start preparing for that?
Well, you're gonna start preparing your first semester. If that's what you're choosing to do, you're gonna start preparing your first semester. So I guess I'll give you just the basic admissions requirements or criteria, so to speak, in order to be eligible to apply. So like I said before, you have to be admitted to the U of M. That's number one. Second of all, you have to have a minimum cumulative GPA of 2.7. That's the minimum cumulative GPA that you have to have. Also, you have to have a minimum science GPA of 2.66. And the science GPA is really, really what we look on. This is a science major in which you're going into. So your science GPA is really, really what's going to hold significant weight when we are looking at you for actually admittance into the program. And the science prerequisite courses is 3 of them. You have anatomy and physiology 1, anatomy and physiology 2, both with the labs, and you also have microbiology with the lab. You can only have the minimum grade that you can get in those courses is a C, right? In order to have that 2.66 science GPA. But I'm not encouraging students to shoot for a C. I'm not encouraging you to shoot for a 2.66 science GPA, simply because it's a very competitive program. A lot of students are interested in the program. On average, we have at the Memphis campus, I have about 500 applications every semester. At the Lambeth campus, I average between 100, maybe 125 applications every semester. But I only have a limited amount of seats at each campus. So out of the 500 applications that I get at Memphis campus, I only have 150 seats. At Lambeth campus, out of the 120 applications that I have about 50 to 60 seats, right? So there's a lot of qualified applicants that meet the minimum qualifications that don't get in, right? And it's simply because other people outrank them, right? So, that's one, I guess, issues that I've had, I guess, explaining to students and or parents is that, well, I was qualified. I met the minimum qualifications. Why didn't I get in? Well, it wasn't anything that you did wrong, so to speak, but it was just other students outranked you, right? So that's why we tell individuals starting their first semester to take your GPA seriously, take your cumulative, take those science courses seriously, because if you are trying to get into the nursing program, which is very competitive, you're going to have to be a competitive applicant in order to possibly get to secure a spot in the program.
So for once a nursing or once a student is admitted to the college, what does a typical semester look like for them? Is it a bit different than being maybe they're taking general education courses?
Very different. It's very different. Once you get into the nursing program, you're done with general education courses. You should be. You can only bring in a maximum of 2 general education courses. Most students only bring in maybe 1, but most of the students, they have all their general education courses completed. Some students, they may have like an elective still outstanding that they might take in their 3rd or 4th semester in the nursing program, but once you get into the nursing program, the courses are a lot different. First and foremost, you don't get to pick your schedule. So when you are in your general education courses, you might be a morning person, right? So you're saying that I'm gonna try to fit my schedule around me getting up early and being done by 12 o'clock, right? You might be an evening person. You might not want to get up early, and you might say, I want to just take all of my classes during the evening hours, so you can sleep in. In the nursing program, you don't get that luxury. So you come into the program as a cohort, right? And the courses are preset. The times, the days, they're all preset, right? So the good thing about it is that you're not competing for seats like you are in general education courses. General education courses, you're trying to, as soon as that registration opens, you're trying to hurry up and go in and register for your particular class so you can have the best schedule. In our case, you don't have to do so, right? You know your classes are going to be there. You know you're going to have a seat. You just, again, don't get to pick what times that you go to your particular classes. In addition to that, you don't get to pick your clinical rotations. Your clinical rotations are randomized throughout your entire program. So we have over 300 clinical affiliations in the Mid-South area. So you are possibly getting exposed to a whole bunch of different, clinical sites based on when it might be Gero, or you might go to St. Jude for pediatrics, or you might go to Regional 1 for med surge, right? So you just get placed in these particular areas. Some of these placements occur during the evening hours. Some of these placements occur during the weekend hours. And it's just, we are really getting you familiar with the different clinical sites, but also being a new nurse. You don't always get the ideal schedule as a new nurse. A lot of the nurses go into, they start during the graveyard shifts, right? And they don't get the luxury of choosing which days of the week or days or times of the day in which they get that they get to work. So it's similar in the nursing program. It's like, this is your schedule. This is your clinical site. We are expecting you to get there. And you have to be punctual at all of these, particularly your clinical sites. We hold our students to a high standard simply because they're representing not only our college but the University of Memphis when they go out into these clinical sites. So they have to be professional, hair groomed, clean, nails, earrings, all of those things have to either not be there as far as with earrings or nails groomed and manicured, so that they can be a good representative of our college when they go into these clinical sites.
So for our nursing students, what kind of services are offered to help kind of support them in particular while they are working on their degree?
Within the college, so within the college, first and foremost, we put a lot of resources on the front end to our N1s. We call students N1. So nursing semester 1, N2s, nursing semester 2, all the way through N5. So our N1s, they come in and they get a lot of wraparound services. When they first come in, we've actually started, and this has been going on maybe 5, 6 semesters now. When I came into the nursing program, myself and the dean, we wanted to have a transition into nursing program in order to change students' mindset to get them to actually think like a nurse. And what we really had found was that students had a troubling time transitioning from their general education courses and the way in which they did things, which, a lot of students, they do well on the general education courses by memorizing material, right? And we wanted to change that model and say, okay, well, you have to transition into the nursing program, and memorizing content is not going to, get you the results in which you need. I always tell the students that because I'm a non-nurse, I could be their patient one day, but I don't need them memorizing what they did in their first and second semester when they have to, take care of me. I need them to understand and to know what it is that they're doing. Right. So we started what we call our academic success program. and we title it Act Like a Student, Think Like a Nurse. So what we've done, and that's for incoming nursing students. Those have all that we have admitted, and before they start the program, they go through this academic success program. So we give them a taste of pathophysiology, we give them a taste of foundations of patient-centered care. We also give them a taste of pharmacology. And those professors, they normally give them an exam, like a 10-question quiz or an exam. And they don't expect the students to know it, but we kind of want to scare them just a little bit so that they can know, like, this is what it's going to take in order to be successful in this program. And this is how you prepare for this program. And we also have other supplemental sessions to that, where we talk about being actively engaged while you're here, being a part of the Student Nursing Association. We talk about being adaptive, because you're going to have to adapt to this new learning environment that you're in. And we also talk about what it takes to ultimately achieve your goals to be a nurse and progress through this program. So that's one of our first things that we offer to incoming nursing students. While students are there, we have peer tutoring that we offer. So our peer tutors are upper level nursing students, and we normally offer it through to pharmacology first and foremost, to pathophysiology. We have dosage tutors. We have even upper level tutors like med-surg 2, but first 2 semesters, pharmacology, pathophysiology, FPCC, Foundations of Patient-Centered Care, and then second semester common. So those are the main ones that you normally get tutoring for in your first 2 semesters. In addition to that, we also have what we call TLC. And TLC means Teach, Learn, Coach. And this is faculty led. So faculty members actually have supplemental instruction that they can have small group interventions with those who need it, right? So some students who are not grasping the concepts as they should, or may not be doing well on a particular exam, a faculty member may refer them and say, hey, you need to go to TLC. And in those TLC sessions, the faculty members, it's small group interventions, and they can really go over the concepts and the why behind the questions. That's one of the big things that we always talk about. What is the why behind this question, right? So those are our main 2 things or 3 things with the academic success program that we do, particularly for our M1 and M2 students, to make sure that they just get on a good foundation while they're in the program. Normally, once you make it past your second semester, I'm not going to say you're coasting the rest of the way, but we feel a little bit more comfortable with you going into your last 3 semesters into the program.
So if a student, those sound like fantastic programs. So if a student is kind of struggling, can they opt into the TLC program, or does a professor need to recommend them for it?
No, it's not. It's completely, they can just make an appointment. So what we do is we have, when they first come in, the first, I guess, normally the second week of the semester, we normally create an academic resources sheet. And this academic resources sheet has the resources that are available to the students every day of the week, right? So my tutors, when I bring in my tutors, they have their hour or hour and a half that they tutor each week and that particular day. So it doesn't change, right? So same thing for TLC. Our faculty members, they have a particular day during the week that they are offering TLC. And with the students, all they have to do is click on that particular link that is on that resources and sign up. That's it. So they don't have to be recommended to TLC, and we encourage students to use a combination of both. Peer tutoring as well as faculty-led TLC. Because the peer tutoring, again, some of the times they can get a better understanding coming from their peers of the content, but then they also might do some deeper diving and have to really get down to the nitty-gritty and have a faculty member actually explain it a little bit better. So we encourage them, again, to do a combination of both. In addition to that, they do have their academic advisor, as well as myself, but normally they'll go to their academic advisor first if they have any other, pertinent questions that they might need answered, or if they're having some additional struggles within a course. And if we need to refer students also out to other offices on campus, I think that really helps with me having a connection with different departments on campus. If we need to refer students to disability resource services, or we need to refer students to mental health counseling, so things of those natures, we can refer those individuals out, and they come in and help us to support the students as well.
That's great. That's wonderful. So you talked a little bit about the schedule that they may have. For a parent or family member, what would you tell them in terms of the amount of time that a student is going to have to commit to this program and to getting this degree?
It takes a lot of sacrifice. I'll be honest with you, to do well in the program. If I had any of my student leaders or just nursing students in general here on this call with me, they would tell you that it is still possible for you to have a life outside of nursing. And that's, I think, a lot of time the misconception of some students. They come in and they feel like, my life is over. I'm a nursing student now. To some extent, you might be a little bit right, but not all the way, right? You have to really manage your time effectively, and you really have to designate considerable hours throughout the week investing in learning the content, right? But you still, you have to break it up as well. So you can't just say, I'm just going to, be all in the books and never come up for air, right? You got to have some kind of balance in order, just for your sanity. And it's a long program, so we don't want you to burn yourself out in the first semester or two. So you still have to find some kind of balance, but you also do have to understand that there is going to be a time in which you can't hang out either with family members or with friends, because you're going to have an exam, right? And those students that have not gone through a program, or even those parents that have not gone through a program, sometimes may not understand when a student has to tell them no, like, I have to study, right? So I think that is one thing that, how parents can also be supportive to understand, like, it's a rigorous program. If it was easy, everyone would do it, right? So it's going to take some investment in one's time in order to really grasp the content, make it through the program, and ultimately succeed by passing Nclex and becoming a registered nurse.
Great words of advice for our parents out there to kind of understand the program a bit more. So as a student prepares and gets closer to that last semester, are there any licensure exams or anything kind of culminating that a student has to be prepared for when they're getting ready to graduate?
Well, I mean, the main exam is the Nclex. That is basically what makes you a registered nurse. So that's also another misunderstanding, I think, of those that are coming into the program, whether it be students and or parents, just not having the terminology correct. A lot of students say I'm in an RN program. You're not, right? You're in a Bachelor's of Science in Nursing program, BSN, right? What you're trying to gain is an RN to be a registered nurse. In order to be a registered nurse, you have to pass Nclex, right? So in order to be eligible to pass Nclex, or in order to be eligible to take Nclex, you have to pass a nursing program, right? So it's steps in order for you to become an RN, right? The ultimate achievement is passing Nclex, becoming a registered nurse. So all of our exams, and that's really what we sell our program on. For the past couple, I guess for the past 3 years now, we've been around 88 to 91% Nclex passer rating, first time passer rating, and that means a lot, simply because there's no point of you going through a BSN program if you can't pass Nclex. The whole point and purpose of you going through this program is for our faculty members to prepare you to pass Nclex, right? So the entire time you're in the program, all of our exams are Nclex style exams. And that's the reason why we have such high first-time passer rating on our Nclex exams, because the students have been preparing for this since they entered the program. They've been in the semester, they've been in the program 5 semesters. All of their exams have been similar to what an Nclex style exam will be like, right? So the students are already mentally prepared as they are going into the Nclex exam. And it's not anything new to them simply because they've been doing it all along. In addition to that, it helps that not only are the type of exams that they have Nclex style, but the questions that they have in their exams are Nclex style questions. Some of our faculty members have also written Nclex questions, right? So it also helps that you have, or that they have the faculty members that have possibly written exam, Nclex exam questions. And of course, all of them are registered nurses as well. So it just helps to have one who has been through the process, who has passed an exam in order to prepare the students for what they are about to take. So that's the main thing. All the exams that are in the program, in your particular courses, they are just preparing you for the big Nclex exam.
For the exam, is that something that they do their last semester, or is it something that they do after commencement?
That's after, right? So the Nclex, it's a national exam, right? So it's not, you don't take it while you are a nursing student, right? You're not eligible yet to take it. So you take it once you, because what we do is once you graduate, once the degree is conferred on your transcript, from there, we send it to the Board of Nursing to say this person is eligible to take this exam. And it's up to the students to register, right? Some of the students, they register for the exam 2 months, right after they graduate. Some of them, they wait a little longer because they might want to take a little bit more time to study. So they might take it within 4 months, right? So it's all up to them when they want to take the exam. But the thing about it is that they take it after they complete the program, because they won't be eligible to register until we, as the college, send their transcripts with the dean's signature and say, yes, this student is certified and ready or is eligible to take the Nclex exam. So they take it whenever it is that they choose to after they finish the program.
So I know you talked a little bit about the clinicals that students have to participate in. Are there other opportunities for students to meet with potential future employers? Do y'all do a career fair or anything like that for students to kind of help them place and find a place after graduation?
Right. So we do a career fair every semester. It's a requirement for our 5th semester students, which are our graduating students, to participate in the career fair. This year, we actually had our first virtual career fair, and it went pretty well. We had about 16 employers that logged in, and the students kind of logged in and out of the different Zoom sessions and heard what the employers had to offer. And we had employers as far west as Nebraska, as far east as this year, I think Chattanooga maybe was our furthest east school this year. But we normally have Alabama, far north we have St. Louis, and we also have our regional or our local sites as well. But for the N5s, it's a requirement that they attend the career fair, right? As a part of their class, it's a requirement for them. Other semesters, it's just encouraged for them to attend, particularly 3rd semester students, because those students have opportunities to achieve internships and or externships at these particular sites. Now, we don't require that a student have an internship while they're in the program, but a lot of our students do, simply to get more experience and also just to get their foot in the door at a particular site that they might have interest in working in once they do graduate. So 5th semester students, yes, they are mandated to attend the career fair every semester. And the other N3s and N4s, we try to encourage them to attend as well to secure intern and externship positions.
So if a student has thoughts of maybe graduate school or going further, is there anything that they should do while they're an undergrad to prepare for that? Or is that something usually they do after they've been a professional for a little while?
It really just depends on what graduate program they might be trying to go into. The graduate programs that we offer currently is our MSN, and we have a couple of different concentrations, which is executive nurse leadership, education, and our most popular, which is family nurse practitioner. Right. So a lot of times with family nurse practitioner, you want to have some years of experience, or at least a year of bedside experience under your belt before you go to a family nurse practitioner. The education, you can actually go right into the education program right after the BSN, completion of the BSN degree. With exec leadership, it's normally based on, we want to see some leadership potential, because those individuals are looking to become chief nursing officers and other leaders within respective hospitals. So those individuals normally have, again, a good some years of experience before they are really seek entry into that particular major. But we also have some very high achieving and just great potential leaders that kind of start early in the MSc and exec leadership program. So it just differs, honestly, with the graduate programs. We also have recently, this is our third year, we have our PhD program in nursing now. So that is focused on, it's a health equity focus, and a lot of our students that are in that program are aspiring faculty members and want to be nurse researchers, right? So that is also another possibility for students if they, and once they do secure their BSN. But like I said, as far as with graduate school, a lot of students, they look at graduate school after they complete their BSN. All right, because the ultimate goal is, hey, I want to get in, I want to, become a registered nurse. I want to get out in the field. I want to do the work in the clinical sites that I have always, thought and had the passion to do. All right, and then once they get in, well, whether it be they see that they want to advance, or they see that they might want to do something different, or they might see that they want to make an impact, or want some kind of other impact on a particular area. That's normally when they return and come to graduate school.
That's great. Well, thank you so much for joining us. Are there any last words of wisdom or anything else we might have missed kind of in our discussion that you're hoping that students and their parents and families might need if they have a nursing student or a potential nursing student?
I guess I'll just kind of wrap things up and just make sure I preface that we have two different programs, we have two different programs. We have a program on the Memphis campus. We also have a program on the Lambert campus. So you have an opportunity to apply to both campuses. And what we do is, some of those students who might be borderline that, as far as the admissions criteria, the minimum criteria, we try to encourage students to apply for both, just to give yourself a better opportunity to get into the program. And even though the programs are geographically located in different areas, it's still the same program. It's just one is in a more rural area versus one is in a more urban area. So you have those, two options as far as when you are applying to the program. Also, we do offer a lot of financial support to our students. We understand that it's a financial burden just being in the program. It's a costly program with the extra fees and the nursing, fees in which students have to pay for. So we have generous donors, and they have made it very easy for us to award a sizable number of students who are in need of our particular for our scholarship. So that's one thing that we encourage our students to do as well, is apply for scholarships. Now, you cannot apply as a pre-nursing student. Our scholarships are only for nursing students. So you can only get the scholarships once you are in the program. And on an annual basis, we're up to about $800,000 that we can award for our students. So we try to spread the wealth as much as we can to our nursing students. But pre-nursing students are not eligible to apply. But once you do become a nursing student, you do have the opportunity to apply for those nursing scholarships. So,
and is that through the Tiger Scholarship Manager?
Yes.
Okay.
Yes. So all of our scholarships are in Tiger Scholarship Manager. Just recently, we did get a couple more grants. I received a grant to support students from disadvantaged backgrounds, which was about $3.2 million over 5 years. Dr. Zahn, which is our dean, received almost $1 million grant established for rural nurses, and leading healthcare through diversity. So all of those, we are always seeking more opportunities for us to, help offset some of the costs to our students. So it's a good place to be. It's a good supportive environment and very respected program, not only in the community, but in the region and in the state as well. So we are just trying to continue to lead the way and promote health and, look at everyone from a holistic standpoint and try to be the best nursing program that we can be.
Well, thank you so much. We really appreciate it. And we really appreciate all of our nurses out there who are doing really great work, and that they will go out into our community and make a difference for everybody. Well, thank you so much, Eric, for joining us, Dr. Bailey. We really appreciate it. And thank you all to our parents and family members who have joined us. And if you ever have any questions, just let us know. Thank you.
I'm good. Thanks for having me.